Bismillahirrahmanirrahim. Assalamu alaikum. Today we will talk about infantile hemangiomas, also called strawberry nevus. Do you know, is it also called a tumor, which is called a benign vascular tumor? It looks scary, but that's true. It is a tumor. So we will discuss about what are the hemangiomas. Is it a tumor? What is the pathophysiology of infantile hemangiomas, and then types and phases. There are three types and three phases of hemangiomas. How to recognize that this is a hemangioma, and then the management, when to refer, examiner's favorite favorite question, when to refer the patient who is having hemangioma, or what other investigation you will do if you have faced any baby who is having hemangioma. And then at the end, Fez syndrome, relation of hemangioma with the Fez syndrome. In the MRCPCH exam, examiner wants you to know that hemangiomas are a tumor and it is a benign tumor, but when to refer, what other investigation you will do. Usually there is no investigation, but some conditions you must do investigations. So in foundation of practice, they will give you the description of the lesion, and in theory and science, they will give you pathophysiology of the lesion, and in applied knowledge in practice, they will show you the picture and they will ask you the question. So what are hemangiomas? Actually, these are the common tumors of infancy, which are the benign. These are also called strawberry nevus and also called the birthmark. So the pathophysiology, actually these are the vascular endothelium, which, tumors of vascular endothelium, and this is the reason they develop this benign hemangiomas. The types, there are three types of hemangiomas, infantile hemangiomas. First is superficial, second is deep, and third is mixed of both superficial and deep. So in superficial, it is vivid red color, well demarcated plaques, or nodular look like strawberry. This is the superficial. These are superficial hemangiomas. Deep hemangiomas, how deep you don't know. These are the skin colored, are less well defined, look like bluish lump outside. So these are the deep hemangiomas, and the third one is mixed of both, and they have the both qualities. This is the important phases. You should know about the phases of hemangiomas. The first phase is proliferative phase, which is called also the growth phase, and it lasts 6 to 9 months. Means during this phase, the hemangiomas are continuously growing, and after that, the second phase has started. This phase lasts 6 to 9 months, called proliferative growth phase. And second phase is stabilization phase. This in during this phase, the hemangiomas are stabilized, it's not increasing, not decreasing. And after that, there is a third phase, which is spontaneous involution. In this phase, they are becoming to be reduced, and they change their color as well. So it must know, because you have to explain to the parents. It's very scary for the parents for any birthmark which is disfiguring their babies. So spontaneous involution period, in which they became red color, and after that replaced by purple hue, and then gray centrally, and then peripherally. So after that they became flattens and softens. So the lesion explanation in the question, these are the blanched macule, erythematous or telangiectalic patch or bruise-like areas. As you know, first few months in growth phase, proliferative phase, they are increasing. After that stabilize, and then they spontaneous involution. But sometimes it will take 3 years, and even very small number, it will take sometimes 8 to 9 years. So when to intervene, this is the very important thing. When to intervene these hemangiomas, if it is segmental hemangiomas, either it is a segmental hemangiomas or involving any vital organ, then you should intervene these hemangiomas. So these are some pictures of hemangiomas. Just be the familiar. So in this picture, if you will see, there is a very large hemangioma, and which is occluding the eye and obstructed. It can obstruct the vision, so it affect the vision. This need to be treated, need to be evaluated. And if it is in the mouth, it needs to be evaluated. It can occlude the airway. So these are the hemangiomas. You need an intervention. It's not like that every benign hemangioma established naevus need to be reassurance only, but some hemangiomas need intervene. These are the multiple hemangiomas. So which hemangioma need to be intervened? Like for example, if it is involving any vital organ or the segmental hemangiomas, vital organs like it is near the eye, near the nose, ears, lips, airway, and anogenital tract. These hemangiomas need to be intervened. And segmental hemangiomas, it means cervicofacial, mandibular, or beard distribution. Also, these are associated with airway hemangiomas. So these hemangiomas also need to be ruled out. And sometimes there is involvement of upper airway during growth phase, proliferation phase, and babies may present early proliferation growth phase of hemangioma with stridor. So these hemangiomas also need to be ruled out. If hemangioma more than 3 centimeter large or more than 5 in numbers, these hemangiomas also need to be evaluated. So usually if these are multiple hemangiomas more than 5, so what other investigation you will do? Actually hemangiomas can be in the internal organs like in the brain, in the heart, inside the liver. So most common site of internal organ is liver. So if you will face these kind of multiple hemangiomas, the next investigation of choice, you will do the ultrasound to check the liver, either there is any lesion in the liver or no. So these are the things you should know about the hemangioma. At last, there is the management. What is the management of hemangiomas? Most are self-limiting benign lesions. They will disappear by itself, sometimes at the age of 1 year, sometimes 3, and also maximum age 8 to 9 years, which is very rare. Which hemangiomas need intervention? As we discussed, which compromise the vital organs are segmental hemangiomas and Fess syndrome. These all need to be intervened. Like if they are compromising the vital organ like eye, nose, ears, lips, because lips can obstruct the airway. And then anogenital tract. These are the organs. If near hemangioma is near these organs, you should be worrisome that need to be excluded. The other causes like it could be in the internal organs, and if it is obstructing that organ, it should be intervened. Segmental hemangiomas, cervicofacial hemangioma, mandibular and beard distribution, which are associated with airway hemangiomas as well, in which there is the child may present with stridor and during the growth proliferative phase in segmental hemangiomas. The Fess syndrome, it need MRI and MRA brain and neck, and need ophthalmic and cardiac assessment. What is Fess syndrome? I will tell you in the next slide about Fess syndrome. Before we will go to the next slide, I would like to tell you that these hemangiomas, before they were treating with non-selective beta antagonist propranolol for infantile hemangiomas. The mechanism of propranolol in hemangiomas is vasoconstriction, and the vasoconstriction, and it will cause the blocking of proangiogenic signals such as vascular endothelium. As pathophysiology, it arises from the vascular endothelium and also vascular endothelial growth factor and apoptosis. But this drug propranolol, as you know, it is contraindicated in a patient who is having heart block second degree, and is the patient who is having hypotension and bradycardia, if patient is having asthma or hypersensitivity reaction to the airway. So we cannot give this drug. But nowadays, most commonly they use the laser therapy. And also there's some cosmetic issues. If parents are having cosmetic issues, because it will cause disfiguring to the parents, so they need a laser therapy. The other thing, they may ulcerate and they may bleed. This is also one of the complication. If they is having ulceration and it is having profuse bleeding, as highly vascularized. So the treatment of this ulcerative and profuse bleeding only to apply firm pressure for the 10 minutes or till the blood stop. This is the only treatment to apply the firm pressure, but after that it just give because it is painful, so need some topical local topical creams and sometimes antibacterial to prevent secondary infection. So these ulceration may cause permanent scar later on. This is the only thing. But if they have profuse bleeding, only to apply firm pressure to stop the bleed, and then you will give for the pain analgesia, and also some local topical ointment, and also bacterial cream to prevent the secondary bacterial infection. What is face syndrome? Face syndrome is a P for posterior fossa brain malformation, H for hemangiomas, segmental or facial, A for arterial anomalies, C for cardiac anomalies and coarctation of the aorta, that's why cardiac assessment is important. E for eye and endocrine abnormalities, that's why eye assessment is important, and they will do the MRI or MRA because they have the posterior fossa brain malformation as well. The face syndrome having the hemangiomas, these need to be ruled out by the MRI, MRA, cardiac assessment and ophthalmological assessment. So thank you very much. This was all about hemangiomas, and these are the birthmarks, also called strawberry nevus. Mostly they don't need any intervention. They have three phases: proliferative growth phase, which lasts 6 to 9 months, and then they are stabilized, and then spontaneous evolution, in which they become bright red and then become purple and gray centrally and peripherally, then flattens and softens. Most are self-limiting, only required reassurance. Sometimes they have ulceration, cause the bleeding and disfigurement. So if they have the profuse bleeding, just apply the firm pressure. If there is a pain and ulceration, which need to be give the analgesia, local and also sometimes oral analgesia. So hemangiomas need to intervene if the involvement of compromise the vital organs like near the eye, nose, ears, lips, airway, and enogenital tract. Segmental hemangiomas need intervene. These are the cervicofacial, mandibular, beard distribution, which are associated with airway hemangiomas. Baby may present with stridor, and the treatment is non-selective beta antagonist propranolol and laser therapy and surgical for the, if no response then we'll go for the surgery. So the thing here, you should know, if multiple hemangiomas more than 5 in number, the next investigation you should go for the ultrasound abdomen to check for the internal organ lesion, which is the commonest site is the liver. So this is all about hemangiomas. If you will go through 2 3 times this lecture, you will understand all about hemangiomas. Thank you very much. Assalamu alaikum.